My name is Susan Moira Carding, and I am currently living in Spanish Fort, Alabama. About 8 months ago, I started having trouble with my grip. So I spoke with my neurologist. He did some testing and said, I'm going to send you to a specialist because I think you have ALS, which was quite a shock. My lungs are not expanding like they should. And so the doctor there prescribed that I use a breathing machine. And so what he recommended was the Louisa ventilator.
ALS, it affects patients' breathing. Most patients with ALS have a weaker respiratory system, weaker muscles. What this ventilator does, it takes a break off of those muscles and it helps do the work for you. So they're able to relax and rest those muscles. That way during the day they have more strength to breathe better during the day.
The support that I've gotten from Viamed and their representatives has been excellent. It's very important to me to have a respiratory therapist come and help me adjust the machine and answer my questions.
The support Viamed provides, I believe, is mostly having a personal respiratory therapist with clinical skills, and they actually can adjust settings and stuff for patient comfort. For like this patient, she felt like it was a little harder for her to breathe out, so I adjusted sensitivity to her, and it definitely helped her be able to breathe more comfortable. So having a personal RT with a little experience, I believe, goes a long ways.
Justin came and went through everything with me, told me if I had any questions, to call him, and I have called him several times, and he's come and adjusted my machine. It's a learning curve using the machine and getting comfortable with it. And Justin's been great.
So Miss Susan, the first thing we had to find out was the right mask. It's hard for her to use clips to push and pull. So we went to the magnet, which was a lot easier for her. So I was able to get it adjusted to her. She also has a secondary setting that we can use for mouthpiece ventilation. So during the day, if she wants some help taking some deep breaths just to open her lungs up, she has that option as well. All of her numbers, everything looked good. I monitor those. And quality of life, I feel like, is gonna go a long way with this.
One of the problems with ALS is it attacks the muscles in the lung. It's weird how it affects different muscles. It doesn't affect your heart, it doesn't affect your brain, but it does affect your lungs. So keeping them open and flexing them has to make a difference. Well, according to my neurologist and pulmonologist, it does make a big difference.